Hello to everyone. I hope you find you well and safety in this time. I'm Roberto Scrascia. I'm a dentistry from Italy, and I'm so glad to present to you this webinar about Osstem products. I'd like to start my webinar with these words of the Osstem CEO. Osstem features technology and superior quality, product that dentistry can trust. That is the mission of Osstem Implant. I'd like to underline these words because I have a very good feeling with Osstem products, and I think that Osstem products improve the quality of my daily practice. Let's start with this webinar. I'd like to call it this webinar Osstem Solution, a surgical kit for each type of intervention to be done. In this way, I'd like to present to you some kinds of Osstem kit to resolve different kinds of surgery timing. First of all, I'd like to show to you the heart of the whole products of Osstem, that is the implant fixture. I'd like to underline the TS fixture. I think that is one of the most of the better implant fixture present on the market because inside itself, TS has all the feature to have a quality and reliability in time of the implant fixture. TS exists in two kinds, in two shapes. Mini and regular, mini platform and regular platform. Mini platform is about 3 millimeters and 3.5 millimeters in different lengths from 8.5 to 13 millimeters. While regular shape is in 40.5 and 5 millimeters from 7 millimeters to 30 millimeters of length. And the 5 and 5.5 exist in the 6 millimeters of length. Some features of the implant connection of Osstem TS. We have 11-degree Morse taper and an internal X. And the difference between mini and regular is in the size matter of the screw. We have 2.1 millimeters and 2.5 millimeters from mini to regular. We all know that we have two different ways to do a surgery. We have the one-stage technique that I prefer when we screw the healing abutment during the first time, or we can have the two-stage technique when we screw the cover screw inside the fixture and then cover all, and in a second time we put the healing abutment. To do the two-stage technique, we have a very smart cover screw in color coding that help us to find the cover screw under the mucosa. I'd like to show to you the area X of the cover screw because during the conference it's a very frequent ask to me, and I want to show to you is the well done position of the cover screw. This is the one on the left and not on the right. We have a different size matter of the healing abutment, and above all we can see on the picture on the left the right position of the healing abutment and not this one. We know that we can realize two kinds of prosthetic solution, the cement one and the screw one. I prefer the screw, but we know that we have the cement too. And we know that we have the possibility to choose all the possibility to customize the prosthetic restoration, because we can choose if we want the X or non-X, if we have a single crown or a bridge. We can choose the length of the transmucosal path, we can choose the diameter of the base of the crown. And this is a picture about the recommended size matter of the abutment for each shape of tooth. And above all, I'd like to show to you the RX Opti of the classic transfer abutment. This is the correct position and not this one. I like to say to you that it's a way to prefer is to do RX of the abutment when we try it. We know that mini implant and mini abutment, because if we put a mini abutment in a regular fixture, we have a gap between the abutment and the fixture, and the regular abutment don't fit in mini screw. We have a very smart prosthetic kit. We have the torque wrench, different kind of screwdriver. We have the angle torque screwdriver, and in another webinar I showed to you the feature of the angled screwdriver. And we have the steel bow to adapt the screw of the torque wrench in a handle way. We have two kinds of screwdriver, short and long, with a head of 10 millimeters, but I'd like to show to you another kind of screwdriver, the very extra short, the mini type, with only 7 millimeter head and a very short drive. And it's, for example, is very useful in the distal sector of the mouth, for example on the first or second molar. To realize a screw prosthetic, we know that we need the TS link abutment, and TS link abutment is the digital way of Osstem to realize the screw crown. We need to have the TS link abutment with TS scan body or lab or scan short or long type. We need to have the link abutment, and link abutment Osstem is the one of the best link abutment present on the market. We have two ways to choose, X or non-X, for single crown or for bridge. We have 1 or 2 millimeters of transmucosal path, and it's a very important feature. We have 3 or 5 millimeters of link connection to the crown, and we have the anti-rotation to connect the crown. And above all, the TS link abutment has the ebony gold screw, and it is a very important feature. The scan body to use in the mouth of the patient exists in two ways, long and short. For example, I like to show you just digital impression with a short scan body. It's very important to put this connection on the vestibular way, because this connection help us to find the anti-rotational way of the crown. Then, Start with the other kit. Now we have to sew the prosthetic kit. Now we can see the parallel kit. Parallel kit, I want to do a little presentation of my daily practice. I'd like to use guided surgery, but sometimes we don't have the possibility to use guided surgery, but I'd like to put implant always in a prosthetic way, and parallel kit help us to do it. I'd like to show an article that he have published last year about parallel kit. This is the clinical case. We can see in this picture that we have only hopeless teeth and we need to extract this teeth. But above all, we need to do a very revolution on this mount and of this smile. But first of all, I'd like the way of the full denture. We need to collect all the information, and in this way, first impression, vertical dimension, and setup of the teeth. Then, thanks to the setup of the teeth, we can realize the surgery time. For example, in the lower jaw, realize an overdenture, an implant retention, implant support overdenture, while in the maxilla, I realize an hybrid prosthetics, and I used the parallel kit to put the implant in the way that I have planned. This is the parallel kit. We have this tool. We can choose the point where we can put the implant, then extract the teeth, open a flap, do a bone osteotomy, and in this way I realize a prosthetic bone osteotomy. Then fix the parallel kit in the middle line and put implant where I have choose to put them. We can see the TS3. If I remember well, is a 4 millimeters of diameter and 11.5 of length, millimeter of length. We can see the implant, the picture of the implant, and because in this way we realize a post-extractive implant timing, I'd like to put the fixture 1 or 2 millimeters under the bone level. The one-time technique, one-stage technique of surgery, and in this way I have screwed the healing abutment. We can see that the implants are in the position that I have planned. The sutures, we can see the temporary denture that guide the healing of the soft tissue, 10 days of healing, and during this time we need to check the fit of the temporary denture. I'd like to use these impression materials that help us to find the pressure spot, and in this way we can take away this pressure spot and guarantee a safety way of healing of our implants, 30 days of healing, and after 2 months this is the healing and the quality of the soft tissue around our implants. Then we can take the transmucosal way and put the low profile abutment to realize the implant retention soft tissue overdenture. This is some steps of the overdenture when we need to lower the low profile attachment, while in the maxilla I'd like to plan always everything. This is the setup of the teeth of the maxilla, this is the temporary denture of the maxilla, and I used to transfer the information of the temporary denture to a surgery template. I will put the implant, thanks to the parallel kit, in a symmetric way, These are the implant in the mouth of the patients. This is the temporary denture. This is the healing of TS3. TS3 every time help us to have a amazing healing. This is the temporary denture, and this is the duplicate, the cross-mounting of the temporary denture. I'd like to use this cross-mounting to like a customized tray for the impression. And in this way, I put all the information in one time to the dental technician. I'd like to check my impression with this key, and then the dental technician go to the definitive prosthetic work. This is the definitive prosthetic setup of the teeth, and we start from the implant, the check of the impression, the low profile attachment that I have used as MUA, the metal reinforcement of the hybrid prosthetics. This is the final work, and I'd like to underline that I've used 6 TS3 implant and 6 kind of low profile attachment to realize all this work. This is the patient at time 0 and at the end of the work, thanks to the parallel kit. This is the patient at the end of my treatment. Parallel kit, we can use the Osstem parallel kit also in the fixed prosthetics, because we have a lot of tools that we can use. We have this single guide of different diameter. If we need to put, for example, an implant in a molar zone, the molar we know that is about 10 millimeters. We can use the guide of 10 millimeters, for example. Then we have the bridge guide. If we need to put the implant in different position, but we need to put in a perfect distance between one implant and the other implant, and we can use for example, the bridge guide. I'd like to show this short movie about parallel kit. We have 22 millimeters of space, and I like to choose this prosthetic space, 6 millimeters for the premolar and 10 millimeters for the molar. And this way I need to put the implants in the perfect position of this setup of the teeth. And thanks to parallel kit, we have different diameters of this guide. And for the premolar, I used the 6 millimeter guide, and for the molar, the 10 millimeters guide. This is the 10 millimeters guide. And we can see the whole of the 6 millimeters guide. And this way we put the implant in a prosthetic way. A parallel kit help us and give us the possibility to realize in time, in a smart way, all the prosthetic restoration. We can see it with 2 TS3 implant, 1 stage technique, the suture. After 2 mounts, I take away the healing abutment, take an digital impression, and we can see the digital setup of the teeth. We can see that the prosthetic hole is in the middle of the prosthetic teeth, and on the right, we can see the final restoration. This is the lower jaw restoration, and in this position I used the parallel kit and another kind of healing abutment, the peak healing abutment, that give us the possibility to sculpture the transmucosal root. The mucosa, the flap, the parallel kit of 10 millimeters, the implant, and the peak healing abutment. We can check with the intraoral scanner the size matter of this the transmucosal root, realize the screwed crown, but I'd like to use parallel kit in the post-extractive socket because I think that we need every time to put implant in the best position, in best prosthetic position. And if we have very good feeling in our hand, but we need to sometimes a little help to put the implant in the best position. And in this way, I'd like to show to you another clinical case. We can see the crown, the lost crown, the hopeless teeth. We can see the space between mesial and distal teeth. This is the guide of this implant. We put the implant 2 millimeters under the bone level, the peak healing abutment, to customize the emergence profile of our crown. The healing, the transmucosal root, the digital impression, then the crown. The follow-up after 4 years. Parallel kit, we have the bridge guide to customize some different measures. For example, if we need to put the implant for the first to the second implant about 12, 70, 22, 21 millimeters. For example, we can see this surgery, the impression, digital impression, the OBJ file of the impression, the CAD/CAM project, and the result. And we can realize a very smart prosthetic protocol, that is the screw retainer bridge or the screw retainer single crown. In this way, we can put the implant in the middle of the prosthetic crown. Implant. Parallel kit for the prosthetic space, for example, in post-extractive. This is a case of canine of 10 millimeters of space. We can put the implant in the best prosthetic way to realize a screw crown. The bridge guide, for example, a very simple case of everyday life. 2 implants, 3 crown, but this is a metal ceramic realization, but we can see that we can put the implant in the best position, prosthetic position. Now, another kit of Osstem. Sometimes we need retention for our lower denture, and we can realize, for example, an upper denture. But sometimes we have very poor bone, and we have the asset kit that help us to realize in a very safety way the split crest technique. We have the crestal remover to realize a horizontal osteotomy, the initial drill to realize the first insertion of the pin guide, and the saw to realize the splitting of the bony crest, and then the bone expansion. We can see now the saw, then the bone expansion, and we can see in this picture the splitting of the crest, and then we can see the insert of the fixture, and then the overdenture. Another clinical case. In this case, we can see a split crest in maxilla. Split very large sides, and put 3 implants and fill the gap with Osstem bone. And I have inserted the implant thanks to the parallel kit. Now, another kit, the Smart Builder. The Smart Builder helps us to put implant always in the prosthetic way, but in the same time to guide a bone regeneration using the stability of the fixture. We have different shape of the Smart Builder. We have the one wall augmentation. We can see the 3D shape and the unfolded shape. The two wall augmentation, 3D and unfolded, and the three wall augmentation, 3D shape and unfolded. We have an healing cap of different sides, and the heart of this kit is this pin that we can screw this pin inside the implant and help us to fix the Smart Builder. We need the cover cap to put the healing over this pin and the cap ejector to take away when we leave the Smart Builder. Now we can see this post-extractive case, parallel kit, guide, insert the implant in prosthetic way, and Smart Builder to fill the gap around the extraction of the lost tooth. We can see some particular of the Smart Builder. We can turn the titanium guide around the bone defect. And this is the healing. Peak healing abutment to customize the emergence profile of the implant, Osstem TS scan body short type, and screwed crown. Now we have quite at the end of this webinar, I'd like to show to you the one guide. One guide is the one of the smart solution that Osstem offer to us. Guided surgery is the prosthetic way to plan dental implants. We need to collect all the information, and this is the key point, because we need to have Cbct of the patients, the mucosa, the project of our teeth, the antagonist, and the marker scan. We know that we can have three types of guided: bone supported, mucosa supported, or tooth supported. And this is the feature of the one guide. We have two different sides of the drill, and a very fantastic feature is this one. We can have the open hole to end is a very fantastic way to put implant in the distal sector of the mouth. Now, another feature that help us but bring the one guide system to be one of the best system in the market is the double fixation, because with the first drill of the system, first contact the surgery template and then the bone, and the second drill first contact the surgery template and the drill of the first drill, and in this way the drill don't change the way. We have all the precision. Now, if we have an intraoral scanner in our dental office, we can scan the prosthetic project. Now we can see a short movie about to take the digital impression of a lower denture that I have used to realize a guided surgery for an overdenture. We can check all the sides of our prosthetic project, And thanks to the market, we can superimposition all the information. We match all the information, and we have the CBCT, the mucosa level, the bone level, the position of the tooth, of the teeth, and we can plan the Osstem TS3 implants in the best position way. But we need always to start from a prosthetic project. Now we can see a kind of guided surgery for the overdenture. This one, I'd like to realize this kind of prosthetic and surgery template with my boss, my mentor, and my master, Professor Marco Tallarico. And I'd like to thank my dental technician, Luigi Secondo. Now we can see that this surgery template is very, very smart because it's a denture with information, the position of the implant. The patient can have this template with his mount. We can put the fixation pins, and they like to underline in identless jaw. We need 3 or 4 pins to stabilize the surgery template. We can see the sequence of the drill of the one guide, and we have a lot of literature about one guide because we have a surgery template without metal sleeve, and is a very important key factor because without metal sleeve we have a very cold ambient to drill the implant sites, and we have a very big precision, but above all we have the possibility to realize this surgery template with a 3D printer. This is the sequence of the drill, very, very fast and very, very big precision thanks to Osstem One Guide TS3 Osstem implant. Okay, we have the great torque, and go to torque wrench to finally insert the implant. The other implant in this side. We go with the micromotor until the torque, and then put the torque wrench to put implant in the final position. This is the two kind of hole, closed and open. Open is very, very smart when we have few space. Then Cbct, prosthetic planning. We can plan the position of the implant, the surgery guided template. This is the fit of the surgery guided template, and the open hole that in the distal way help us to put the implant in a very, very simple and easy way. And then open gate help us to have optimal irrigation of the site. Now we can see another feature of one guide, but in a big restoration, in a complete restoration between the two arches, we need to detect the vertical dimension. Then we can transfer to digital this vertical dimension. We can use the digital smile system by Luca Hortensi to have the setup of the teeth, and then the dental technician can match all the information to realize how prosthetic plan, that we can print this prosthetic plan and use it to realize the guided surgery. This is our prosthetic plan. The byte for the 3D marker and the cross-mounting of all the information. This is the 3D model of our upper jaw, the surgery template, and the byte index to put the surgery template in the best position. We can check and plan every implant position and we can see in this clinical case that in the molar zone of the maxilla we need to have sinus lift to put the implant in the best position way. And now I'd like to show to you the Cascade, but another version of the Cascade of the Osstem, but the one Cascade. That is the Cascade for the guided surgery. Now we can see a short movie about one Cascade, short movie that I have realized with my boss Marco Tallarico, that I'd like to thank in every time. This is the maxilla, the surgery template, and the result of the surgery time. We can see that in this position, we realize a sinus lift through the guided surgery. Osstem TS3 implant, short movie of the drilling sequence and the position of the fixtures. The torque wrench to put the implant in the best position. The implant. Optimum irrigation thanks to this plastic template. And the one guide. One casket for one guide. We can use the cast drill to the sinus floor and then take away the surgery template, go with the hydraulic sinus lift and then put the implant thanks to the surgery template. Now we can see this short movie. The hydraulic sinus lift, and then we can put the bone materials inside the sinus and then put the implant. Now this is the RX OPT of the patients at time 0, our prosthetic plan, and this is the OPT after the first time surgery. We can see that thanks to one cascade and one guide, but with one cascade we can change the shape of the sinus and put the implant in the best prosthetic way. The healing, the TS abutment for 0 degree, in the lower jaw, the low profile attachment for overdenture, the hybrid prosthetic for the maxilla. Now I'd like to underline that everything's become from the full the setup of the teeth of the full denture. This is the final work, how to deliver the final work. We can see the TS healing abutment. We can take away the TS healing abutment. We can see the TS and the healing of the mucosa around our implant, our hybrid prosthetic. Our dental assistants help us to check the hybrid prosthetic, and now we can put the screw in clockwise technique. We can put with the handle screw drive and then with the torque wrench. Just a very short movie to check. Thanks for your kindly attention. Okay. and then the torque wrench. Go. The final work, the smile of our patient. Then the last clinical case of this webinar. We check all the information and we start from the full denture information, the impression, the vertical dimension, and we need to check the middle line, the position of the rest, the big smile of the patients, the nose wings, and the smile angle. We can check the shape of the lower third of the face thanks to the 3D facial scanner. And we start from vertical dimension, setup of the teeth, and one guide. This is, we need to check all the information, to match all the information, a 3D marker to superposition all the information. One kind of 3D marker is the EvoBite by 3DM, and we need the prosthetic plan, and we need the EvoBite. In this way we need to scan everything and the patients go to do the Cbct with this EvoBite. This is some picture of the point reference of the EvoBite, but I'd like to show to you the one of the smart feature of the one guide, this kind of surgery template with double side that we need. This is the cross mounting from the setup of the teeth and our surgery template, a short movie of this kind of surgery, because we have a surgery template thanks to new anchors and one guide of Osstem, in which we have all the information on the teeth, and this is help us to put the surgery template in the correct way. After we can put the pin, we can take away one piece of the surgery template and we have the hole to insert the fixture. Okay, take away the external piece and then we can put the implant. Some feature of the one guide surgery template, some picture of the drill sequence, our fantastic Osstem TS3 implant, the lower jaw at the end of the surgery time, the immediate loading. This is the immediate loading. Then we can put the implant in prosthetic way. Then the final work. Some picture of the final work. From vertical dimension, setup of the teeth, one guide, immediate loading, and then the final work. Other picture. And then our patients with the smile. RxOPT after 2 years. And then I'd like to say to you that the difference from omelette or good job is always the use of the diagnosis of the treatment plan, but above all to use always the correct tools, and Osstem give us all the tools to realize all the prosthetic treatments. Thanks Osstem, and thank you for your kindly attention. Bye bye.